This episode of EMS One Stop is brought to you by Lexipol, the experts in policy, training, wellness support and grants assistance for first responders and government leaders. To learn more, visit lexipol.com. That's LEXIPOL.com.
How'd I feel about being selected? It was definitely an honor. All of us, I think, in EMS, especially those that are promoting to management, really want to be able to make a difference in medicine. That's something that we're all out to do. Honestly, every provider is out to make a difference, but to actually be recognized for it, which you don't always get the opportunity to have, it makes it that much more of an honor to be selected for something like this. Honestly, it's like I said earlier, it's something that we all dream of doing, but not all of us get to be recognized for something like this and actually get to be here in real life, promoting your department, looking snazzy, and representing yourself to this degree, especially from a rural town.
Hello and welcome back to another edition of EMS One Stop. I'm your host, Rob Lawrence, and this week I'm in Washington, D.C., up on the Hill at the American Ambulance Association Stars of Life. We've got some fantastic interviews, segues and clips coming up for you today. First of all, I've got the President of the American Ambulance Association, Randy Strozyk, who will be joining me as we go through. We're going to meet AAA's Medical Director, Dr. Gerad Troutman, and also go up onto the Hill and look at some congressional visits that have been going on over the last couple of days. So, as promised in my introduction, I'm now here and I'm delighted to be talking to the President of the American Ambulance Association, Randy Strozyk. Randy, good morning.
Good morning.
How's your energy level?
You know, first of all, it is such a high you have. We were all on last night, our awards banquet, and our opportunity to get together and one more time to recognize all our stars. So today, getting back up, I'm a little tired. And I've lost some voice, but I'm beyond thrilled. I'm just pumped up, seriously.
Great. Now, you are a man, and I've watched you over the years. You wear your heart on your sleeve, and you get emotional because of the gravity of these events. But, how have the emotions been this week?
You know, it is ecstatic. You know, when the stars come across the stage and you've gotten to know them a little bit last night and you shake their hand and you speak with them and you remember the little tidbits of their life, it's really a gift. And it's an opportunity for me to remember what it is day to day these folks do and to meet their family members and hear all the things they do. I can't replace it.
When we welcome our stars and other EMS providers to the Hill, of course, they're very modest. And sometimes they don't want to actually tell of the amazing things they're doing. But, of course, they have an amazing story to tell.
Well, they do. And it's a natural trait. The first visit or two, they're kind of quiet. You have to kind of prod them out their stories. But as they get comfortable with the visit, and again, our congressmen and senators and staff are so receptive to them. By the second or third visit, they're very dynamic, and some of the most quiet ones come right out of their shell and tell great stories about their life and what they do and why they're here and what it means to them to serve their communities. It's just miraculous to watch. And sometimes we make a little fun of them because the really quiet ones get really animated.
So the stars that have arrived here, we have a record number, but also not only from the continental United States.
No, we've always brought a star from Trinidad and Tobago, where we have a operation down there, and it's always a great chance for them to come to America, and they see their ambassador, and they see our nation's capital, and we get to hear about their family and their life in another part of the world. So, maybe next year we'll get some folks over from your part of the land that, speak English not exactly right.
The Kings, absolutely. Well, we'll work on that. So here's our first invite. If you're watching in Europe and the UK and you want to send people here to Stars of Life to be recognised for doing what is an international job of saving life and actually stopping the suffering and doing just an amazing thing for citizens, come on over. It's an amazing time and you get to see the great capital that is Washington, D.C.
Yes. We would be honored to have them.
Okay, so there's an invite from President Strozyk, but getting back to the politics, of course, we've been on the Hill, we've been in front of elected officials and, of course, and their staff, and it's vitally important to realise that sometimes you may not see the elected official themselves, but, of course, the staff are the ones that brief the elected officials, that perhaps write the speeches, that have some degree of influence, and so we're seeing everybody. But what are the key bills that we are supporting and promoting this year?
Well, we have three areas of legislation that are really critical. First and foremost, because there's a time issue, is the VA legislation. This is to ask the VA to postpone the implementation of on February 16th of next year, where all VA trips, emergent VA trips, would be paid at Medicare rates. We know that that is not sustainable. That will have a massive impact across America for the ability for services to be able to sustain in today's really difficult times, as we all know. There is a House bill and a Senate bill, same language, has bipartisan support in both cases. So we're just working through the process of getting that completed. So that is first and foremost. Congresswoman Perez from Washington State, District 3, has done a phenomenal bill on the House side, which we're working on the Senate side, to put $50 million towards training for new EMTs and EMS staff. And we're looking at that to be a means of, where's our next generation? Where are we going to do to make life easier? You and I have talked about many times the old tradition of work all day and then go to school at night to become an EMT. That needs more assistance today. We have to find new and innovative ways to train our incoming generation of EMS providers. So we're very pleased about that. And then our extenders that we have for our Medicare supplemental payments will expire next year, and we're working right now.
Sorry, this is deja vu. How many times have we extended the extenders by trying to extend them?
I've been doing this for 20 some years. So those will come into play. We don't think that'll be passed this year. It would be great if it did. Santa Claus could bring us something, but we'll be working through that into next year to bring those and get those completed by the end of next year. Our extenders expire December 31st of 24, so we want to get that done. And in the interim, we'll also be on the Hill talking about, other issues that come about, readiness, changes in shortages of medication we've worked with continuously. So our legislative session in 24 will be busy. It's an election year, so that'll make it, give us extra challenges. But I have to say, there has been nothing more powerful than taking our stars on the Hill. And whether they meet an LD, a staff person, or they meet a senator or congressperson, it tells our story and reminds these folks what it is our people do day to day.
So talking of telling our story, yesterday President Strozyk, myself and a few others had a chance to go up into the Senate, and we had an amazing underground tour of the inner workings of the Senate to present the Legislator of the Year to Senator Bill Cassidy. And thanks to the power of the edit and the fact that we're going to do this in post, here's the clip of Randy presenting the Senator with his award.
So on behalf of the 1,000+ members of the association, independent companies across America, we want to present this award to you. And we want you to know that whatever your office needs and help and support from us, we're right there for you. But thank you is too few words.
Yeah, well, thank you. Thank you. It is a great honor to receive this award let me read it, Legislator of the Year, for his dedicated leadership and commitment to champion emergency medical services. As I see that, I'm actually championing the work of these two and hundreds of thousands like you, probably, who are the beginning of the healing process. When somebody is hurt, somebody is wounded, somebody is scared, it is the EMT that first touches that patient and that begins to transport her into the healthcare system, where the rest of the healthcare system can then kick into what it does. But it would not start unless it begins with you. And so to be able to advocate for the good work that you do, I feel like I'm serving patients not as a physician, but as a legislator, but in a way almost as important as that which you do and what the physician does. So thank you for the award, and it is an honor to receive.
So that was a fantastic moment. I'm so pleased we were be up there to film that. But talk about our Legislator of the Year.
Well, Bill Cassidy from Louisiana is a doctor. So when you talk to Senator Cassidy, he speaks about the importance of that we in EMS our healthcare providers. You know, for many, maybe historical, you talked about transportation, that we transported patients. Well, yes, that's what we do. But, you know, we're the front line of EMS. We're the first one at the family's bedside, the person's bedside. And be it the emergent call, be it the transfer, be whatever it is, it's being recognized of our place. And Senator Cassidy totally understands that and spoke to that yesterday. And to have of his stature and his training and his knowledge understand, it really starts to convey the message that, you know, what EMS is and who we are. And then I don't know how many times you and I have talked about it, think about when COVID hit, you know, at 2 o'clock in the morning, we were the ones that came and we had to deal with a whole new level of challenges, not only COVID, but we had to deal with the fact that people didn't want to go to the hospital. So we were providing levels of care that way, interfacing, making sure people had connections. So I see that as a bright future to how EMS will progress in the next decade.
Wonderful. So that's an amazing assessment of Stars of Life. And President Randy Strozyk, thank you very, very much indeed for joining us. My thanks to President Strozyk, and don't forget, you can hear us on Apple Podcasts. You can also see us on video via YouTube. So if you're listening to us, go over to YouTube, because not only do you get the interviews, you can also see the images, the graphics, and actually keep up with what's been going on up here in Washington, D.C. Did you know that the American Ambulance Association has a medical director? Because we're not just transport. We know that. We're actually mobile healthcare. We actually have everything on the back of the truck except the emergency department bed. What better a time to introduce our medical director, Dr. Gerad Troutman. Welcome, sir.
Thank you.
Congratulations. You are the first medical director. And so what's your role, and what are you going to do with us here at the American Ambulance Association?
Yes, so it's been great. So I sat as part of the board of directors with the AAA and as the medical director, and specifically get to give some medical input, because all of our leaders has recognized that EMS is not just a transport company anymore. We are actually a healthcare provider. So sometimes it's important to have a doctor to give feedback on that and to help steer where our discussion needs to go.
As we all know, we are here at the American Ambulance Association Stars of Life. And have you been on the Hill? And obviously you've got the words MD after your name. So obviously what you've got to say to our elected officials carries a lot of weight.
Yes, I've always really enjoyed lobbying, both on state level and here in our nation's capital. So been there many times, talked to many of our folks on driving how we can best give our providers what they need to take care of our patients at home.
Excellent. And so one of the things I wanted to ask you as well, and this is sort of not outside of AAA, but obviously, you know, flu season is coming along. We may, you know, have different variants and spikes of COVID. What should not only our providers, but to the general public be thinking right now?
So it's really important to get a new COVID vaccine. Right now we're looking probably every 6 months whenever the variants change. So very important to get a COVID vaccine as well as a flu vaccine. And one of the newer ones on the market is the RSV vaccine. A little more particular on who should get that, certainly as we get older in life or pregnant. But there are some other specific things that you should talk to your individual healthcare provider about and consider that as well.
So I'm going to step outside of your American Ambulance Association role. Obviously, you are a physician with AMR, GMR, and you're also doing some really important pre-hospital things. And of course, some of the legislation we've been talking about has been treatment in place, transport to alternate destinations, nurse navigation, etc. And you're knee deep in that, right?
I'm very deep in it. I'm really passionate about patients call 911 looking for solutions to a problem, and that solution is not always an ambulance and taking them to an emergency department. So we try to impact their care differently, especially lower acuity patients, because we now have all the technology and tools to treat them in place with our paramedics and EMTs on site, or even treat them utilizing a navigation program from the 911 system, from the PSAP, and maybe get them to an urgent care or virtual care doctor where they can be cared for right in their home. Patients love it, and the best thing is it really puts the E back in EMS and allows us to save our emergent resources for those patients that need those most.
Excellent. Putting the E back in EMS, excellent. Right. But also don't forget, we are the M in EMS as well. This is medical, and don't forget that. We saw the demise of ET3, or the discontinuance of ET3, and obviously that was one of our great hopes to have all of this funded. But of course, it doesn't mean we can't do it. If providing you're talking to your payer and you have the sort of preconditions set, you can actually get on and do it. And I think that's what you guys are doing, right?
Yeah, so we're doing that, but also what we found is by giving a different solution to our lowest acuity of patients, it really gives us operational efficiencies into our EMS system. So we show decreased dry run rates, we see better levels of reimbursement by patients who are having higher acuity emergencies. So it really right sizes the system and makes it better not just for the operation, but ultimately to the citizens, so they have better availability of those emergent resources when they need them.
And that brings us right back to some of the legislation that both AAA and also NAMT are pursuing, which of course is TIP, treatment in place, and TAD, transport to alternate destinations. In other words, the patient doesn't need to go to the ED, even though that's the perversity of reimbursement for EMS. Of course, we only get paid when we take the patient somewhere, but of course there's lots of alternatives if we're creative.
Yeah, no, it's definitely a difficult problem. And what I think is great is we have so many people from different aspects looking at this and really are driving some effective change. We've already seen lots of change so far, and I think we will continue to see great change over the coming years.
Dr. Troutman, AAA's first medical director, the only one. Thank you very much.
Thank you, sir. Pleasure to be here.
Thank you for that. We're just going to take a second to have a message from our sponsor.
Lexipol empowers first responders and public servants to best meet the needs of their residents safely and responsibly. Serving more than 2 million public safety and government professionals in over 8,000 agencies and municipalities, Lexipol offers a range of solutions that includes policies, training, behavioral health resources, news and analysis, and grant assistance services for law enforcement, fire and rescue, EMS, local government, and other agencies dedicated to public safety. To learn more, visit lexipol.com. That's LEXIPOL.com.
And we're back. Don't forget to like and subscribe. But if you're watching us on YouTube, just hit the like button. If you're listening to us on Apple Podcasts, look at your phone. There's a little check mark there where you can actually check that. That means you've liked, you've subscribed. And every time an episode drops, then we'll get notification that we're here. Also, get a chance to give us 5 stars and please, an amazing review. Here on Capitol Hill with Shawn Baird. And Shawn, you have been a part of the balance billing process for the last, I've forgotten now how long, but we had a good hearing, a good session this last week, but some takeaways from you.
Yeah, the Gap Back Federal Committee wrapped up its work last week in our public meetings, and I think we came out with some incredibly solid recommendations for the industry. First and foremost, that we will be coming back to Congress with a recommendation that ground ambulance not be rolled into the No Surprises Act, that indeed would be devastating to the industry and to access for care. Following that, we agreed on a lot of foundational work, definitions, the scope of what ground ambulance really is and encompasses, and we'll be coming forth with a recommendation for how to protect patients from balance bills, but also preserve the industry and foremost preserve access to care.
So we had the meeting, we had the votes, positions have been taken. What's the timeline now to achieve next steps and ultimate decisions?
Well, we are looking at probably a release of the report in late February, early March, so Congress will get their hands on it then. Between now and then, the committee is continuing to convene in meetings to fine-tune the verbiage of the report, what data is included, excluded, and then we anticipate coming up to Capitol Hill to talk about the issue.
Excellent. So watch this space. It's going to happen very, very quickly, we hope. And back to you. That was my report, commentary, and interviews from Capitol Hill here at the American Ambulance Association Stars of Life. Once again, don't forget to like and subscribe. And that's about all for now. I've been Rob Lawrence. This has been EMS One Stop from Washington, D.C. And until next time, bye for now.